Good morning, everybody. Today is Thursday, April 8th. This is the County's Health and Human Service Council's Health and Human Services Committee, and we will be discussing 5 items this morning. These are all executive regulations that need to be updated in some cases to just reflect technical updates. And so we should get through this pretty quickly this morning, and we understand that there have been some updates. Dr. Santiago is going to be receiving his vaccination today. Congratulations, sir. We're all happy about that. I'm receiving mine on Friday. Very excited about that as well. And so for all of you out there, please, now that the sites have been open to everyone 16 and above, there's no excuse. We strongly encourage you to pre-register through both the county's vaccination website, but also the state's as well. Had the opportunity with a number of my colleagues to visit the Germantown vaccination location. The governor came and visited, and while we would have all preferred that it opened earlier, the great news is that it is now open, and it is a very impressive operation. And once it gets fully up and running, we'll be able to disseminate over 3,000 vaccinations per day, 7 days a week. So that is in addition to the vaccinations we're receiving through our other means. And so please, everyone that's out there, go ahead and pre-register and try to get a vaccination as quickly as possible. So with that, we're going to start with Executive Regulation 1920 number 2 this morning, so that Dr. Santiago can be on his way to receive his vaccination. And I will now turn it over to Ms. McMillan to walk us through the packet and make sure that she covers what we're supposed to cover this morning.
Good morning. So yes, this is the business of government looking at executive regulations that need to be updated. And so we will go through those. I think many of these are really very quick. The one we will do following this first item will be about the rental assistance program, which is a follow-up to law changes that the council approved. But our first item today is going to be agenda item number 2, and it is Executive Regulation 1920. And it is about updating a couple places within the Department of Health and Human Services, mostly in the Victim Compensation Fund, and then related to how we would assess fees for outpatient mental health services and other services. And so I would say that the main things in this regulation are to replace the out-of-date name of the Maryland Department of Health and Mental Hygiene with its correct name, which is the Maryland Department of Health. For the Crime Victim Compensation Fund, there's removing the reference to the Statement of Age card fee, which is no longer applicable. For the DHHS schedule of fees, it's updated to name the Department of Health and Human Services, to correct that name, and also references the Maryland Departments of Health ability to pay schedule, but also specifies that no one is turned away for an inability to be able to pay. And in the staff packet, you will see there is a tiered ability to pay schedule dependent on income. But again, the regulation also specifies that we don't turn anyone away for inability to pay. And then also, the regulation removes a very long specific fee schedule for DAVNS, which was the Department of Addictions, Victims, and Mental Health Services, which is quite old because it was what existed before the county consolidated to a Department of Health and Human Services. So this is a long needed update. And with that, I would just say that council staff recommends approval as the regulation came over. And then if you had any questions, Dr. Santiago is here, as well as Leslie Frey, who has been shepherding all the regulations that you're looking at today through the process.
Dr. Santiago, was there anything you wanted to add? This seems pretty straightforward.
That's correct. The only thing I would add is I got information from staff in preparation for this meeting, and they are following the guidelines of this updated regulation already, and they assured me they don't turn away people with the inability to pay.
I see no questions from my colleagues, so can I get a motion to approve the updated regulation as recommended by council staff?
So moved.
Second.
All those in favor? That is unanimous. All right, Dr. Santiago, good luck today.
Thank you so much. I appreciate your patience with me. Yeah.
Mm-hmm. All right, let's go back to item number 1 then.
Okay. Item number 1 is Executive Regulation 1820. This is probably your most substantive one of what you have before you. The rest are really very technical and updating in nature. These are the regulations that will implement the changes that you made to, and I'm going to say this way, the rental assistance program. It's a little confusing because we actually have a program in the county called the Rental Assistance Program. And of course, now we talk about rental assistance programs very generically, and often because of the need to provide so much rental assistance. But this is the program that provides an ongoing sort of shallow, now to be a little bit medium kind of a subsidy to folks who meet certain criteria. When you adopted Bill 2520, you changed the age of eligibility for the rental assistance program from 62 to 55. You clarified the definition of a documented disability. And you removed the prohibition that county residents without certain immigration documentation could not participate. And you provided that the specific benefits would be established in regulation rather than in law. You may recall that there was a maximum that was originally put in the law, which then prevented the Department of Health and Human Services from having the flexibility to increase that payment as the cost of housing increased over the years. So I wanted to turn it over to Ms. Harris and Ms. Bronda. They have just a few slides to show you about the program, and then we can get into the regulation itself. I did just want to mention to you that you'll see at the beginning of several of these packets that the way they came over said it was a review under Method 1. The law is a review under Method 2, and I did check with Bob Drummer, the council attorney, and because the advertising requirements are the same for Method 1 and Method 2, there was no need to go back and re-advertise. We will just note in the approvals that it was reviewed under a Method 2 process. And with that, I would turn it over to Amanda and Alana.
Okay. Good morning, everyone. For the record, Alana Branza, Deputy Chief with Services to End and Prevent Homelessness. So as Linda said, I just want to give a very brief overview, since we did talk about many of these items when we reviewed the code changes a couple months ago, I think it was. So with that, just as a reminder, the RAP program has been around for a while, but when we did in 2017, we did a gap analysis around our services of how we can continue to reach our goal of ending homelessness. And RAP was specifically called out as an innovative tool, as a way that we can use that to end homelessness. It really supports those families that are on a fixed income, whether from disability or pension, who don't have alternative means, and this really closes that gap between our rental prices here and that income. And with that, our goal is really to target those resources to those most in need. Given that need, we know that over 27% of renters in Montgomery County are severely rent burdened, so they're paying more than 50% of their income on rent. We know about 20% of those experiencing homelessness are on a fixed income. And I just want to call out that despite all of our increased funding with rapid rehousing and with some of the resources coming in now for COVID rent relief, RAP is really important because it provides that longer term, right? It's many of these sources are kind of here just for a moment with us, and we're going to leverage them to the extent possible, but the RAP providing that really extended long term. As a reminder, it's 12 months and it's renewable as long as you continue to meet program guidelines. You can renew that as long as you are a resident in the county. So with that, that ongoing need is our homeless continuum does serve over 2,000 households a year. And RAP is a really critical piece in that, in helping us to enable those that are able to self-resolve their homelessness, do that, and those that maybe are with us in rapid rehousing, which is that short-term subsidy, and then you hopefully move on from that. Our average move on is around 9 months from rapid rehousing that people are in the program, and so this could help to bridge that gap to make sure that they are not returning into our homeless continuum after they finish with the rapid rehousing program. It also serves as a key role for those households who we are working to prevent their homelessness, who may come to us seeking eviction prevention, or are in a very unstable housing situation, and this can be that difference that kind of keeps them from entering homelessness and keeps them stably housed. As I mentioned, we are leveraging many of those federal funds that we have. We have our ESG funds that we are using for rapid rehousing, and we have all of the relief funds that we are using for COVID rent relief, but we do need to use all of those by 2022. So we are continuing to look at RAP as that really long-term component that we have here with us. So as Linda noted, we're just making a couple of changes. So we're increasing that subsidy amount is really one of the main goals of this. It was fixed at 200, which when that was initially done was 25% of rent in the county. If we looked at 2-bedroom rents now, 25% would be $437. So we definitely need to benchmark that and have that ability to adjust that annually so that we can be more in line with the housing needs of those in the county. We will be moving to take referrals through our coordinated entry and housing stabilization services. So our coordinated entry is those households that are currently being served by our homeless continuum through shelter or street outreach. And so we would be taking referrals from there to use that as a tool to end their homelessness, and also through those families that come into housing stabilization seeking eviction prevention services. The criteria, we did lower the age from 62 to 55. Some of that is given what we see in our homeless continuum and the challenges of those experiencing homelessness and the aging of that. We wanted to make sure we were making this program available to them. Someone in the household does need to have a disability. And again, that could just be one member, right? It doesn't need to be anyone. And again, with all that targeting, we are really looking to focus RAP on those who are either currently homeless or at imminent risk of experiencing homelessness. I do want to call out, it was changed in the code, and we are also striking that language from the regulation here, that immigration status is no longer an eligibility criteria. The program is open to all residents in Montgomery County. And then just briefly, how are we going to make this happen? So we have been accepting minimal enrollments over the last few years in anticipation of the shift and the increased amount, making sure that we have funds in the account to be able to provide that full benefit. So we do have a current capacity in the program to do that. The regulation has in it that anyone who is currently enrolled who may no longer be eligible given some of the change of the criteria, they would have a minimum of 7 months from the date of regulation enactment before they would lose any benefit. And we will work with them closely over that time to make sure that either they reapply if they do meet the criteria and we just maybe don't have that information on file because we haven't, disability was not a core criteria if you were a family previously receiving RAP. So it could be that they are still eligible. And so we will work with them to make sure that if they are eligible, that we have that updated information to keep them in the program. And if they are not eligible, work with them with our housing stabilization services to help them adjust budgets or, prepare for that graduation, for lack of a better word, from the RAP program. And then we will shift to taking those new referrals from coordinated entry and housing stabilization beginning with the fiscal year July 1. So with that, Amanda and myself are happy to take any questions you have.
Well, thank you for that presentation. Obviously, this issue is timely. We know that there are approximately 2,800 families in the queue, specifically for eviction that we received a report from through the sheriff's office, and there are more than 7,000 families whose landlords have begun the paperwork process for eviction, but have not yet completely gone through that process. So clearly, this is a crisis looming, and I know, and I just want to acknowledge the great work of this team. I know you have been overwhelmed with constituent calls, calls from organizations regarding policy and administrative issues, challenges with the administration of federal funds and getting them out the door as quickly as possible. And I really want to give kudos for your flexibility, your innovation, and your patience as you've worked through many of these respective challenges. And clearly, these very important changes will help more people. And so that is great news. My colleague and lead for homeless and vulnerable populations, Councilmember Glass, has some questions.
A little sun glare. I couldn't figure out where to unmute myself. Thank you, Chair Albernaz. I appreciate the entire work of this committee. You know, we have been committed to this, and Councilmember Rice, long before Councilmember Albernaz and I arrived. So thank you for that. And clearly, you know, the conversations that we've had over the last number of years, quite specifically, wanting to expand the rental assistance program, it's bearing fruit. And so this is a really positive conversation, because I think it was last year that we learned that the $200 had not been changed in nearly 20 years, and seeing that the wait list was just as long, if not longer, than the people actually receiving the benefit. And then we had this pandemic, which only exacerbated the need. And so I think the entire team, as the chair said, has stepped up, and I really appreciate all the work that the Services to End and Prevent Homelessness has done. And I know that my team has been in constant contact with you about services, because all of us have been inundated with people asking for help, every single one of us. And so I appreciate the quick response, or the responses as quickly as you can sometimes, in full recognition to helping us and helping the residents of Montgomery County. And it's towards that goal that I understand why a lot of these changes have been made, and some of them are very practical. And as Ms. McMillan said with the previous packet, you know, a lot of them are technical, just keeping up with the times and making sure that we utilize best practices and are information-based in our policymaking. But there's one facet that I just want to drill down a bit on, and I'm not sure the number, I didn't take note of which page it was on, but it was the process for individuals to receive support. And I think one of the regulations, or I know one of the regulations that you want to change, is that people have to already be in the queue with a service provider. Is that correct? No?
So the intent would be that they are either with receiving services through our homeless continuum already. So whether that's shelter or street outreach, they are connected to our homeless continuum, or they are connected to housing stabilization. And so that could be just they're calling 311, they're expressing that they have an imminent eviction happening, they're connected with a case manager to address that eviction, and that case manager identifies that, yeah, we can pay off their eviction, but they're going to be back in a month, if not for WRAP, right? And so we're going to refer them and bring them into the WRAP program to make sure that that housing stays stable forward. So they don't have to, it's not a minimum, like you have to have been receiving services from us for months or anything. It could be just that we are making sure that that path of connection is strong, that if someone is calling in crisis, right, they're in having a housing crisis, that this program would be available for them.
Thank you for that explanation. And what I want to try and figure out a little bit more is when people call us, and people call all of us, and have been over the last year, especially, and say, I've lost my job, I'm about to be short on my rent, and I need help ASAP. How does this change affect that process?
So generally, how our process is now is that we are a little bit more crisis responsive, right? So it's more at that point of my landlord has filed an eviction, I have a hearing scheduled, there's a judgment against me, I have that red and white from the sheriff, right? And where are we at that point? Because what we do know is that, Chair Albornoz mentioned some of the eviction numbers and the courts coming. We know that majority of eviction filings don't actually result in evictions, right? They are able to settle beforehand, whether it's with our help or with a negotiation with their property manager. They're able to identify alternative, more affordable housing and leave, before that. But it's a fairly small percentage. I want to say it's around 2 or 3% that actually results in a sheriff executed eviction from the number of filings. So we try to focus our response more at that point of the process. So if someone were to call us and say, I'm worried about how we're going to pay my rent, we can provide them with some assistance in terms of conversation with them around budgeting or making sure that they are connected. If maybe they haven't applied for OHEP, for utility assistance, and that's going to make a difference for them to be able to maintain their bills, right? So making sure that they're receiving any other eligibility programs or services that we have that may help them maintain that housing. We have expanded our housing locators. So we have additional housing locators on staff. So if that conversation is, okay, my job has now permanently changed, I know this is not the place for me necessarily long term, can we help you find an alternative place? And at that point, we can have those conversations, right? Like, is RAP that piece that is going to prevent you from doing it? But we would be asking that they're reaching out to us. But in general, most of our response is more at the end of the process in terms of there is an actual eviction action in process. And so we're going to make sure that we're going to work to either prevent that eviction, or if that eviction is not preventable, that the household has a safe and stable place to move if they are moving.
Apologize for the noise in the background. One of the reasons I'm outside today, but I had never heard that data point that only 2 to 3% of these situations lead to actual conviction. And I know when people contact me, they are in fear of conviction, right? Eviction, and it does not satisfy anybody to say, but only 2 to 3%. And so we jump to attention. We want to help people as quickly as possible. And so I appreciate how you've explained this to us and what the regulation actually means. And I'll share with you how my office operates when we receive those frantic calls of concern that we typically reach out to landlord-tenant affairs. And, unless they're being actually in danger of being put onto the street by a landlord, then we'll reach out to SEPF. But what we typically tell constituents is about some of this coordination and contacting landlord-tenant affairs. What else can be done from the council members' side when people contact us, assuming these changes are made? What would the process then be?
Okay, so I before I answer that, I just want to correct the 2% number I gave was I was mistaken. That's the number that actually show up in court, the defendants, so the residents show up in eviction court. It's a little bit closer to 8% of how many are actually result in a sheriff coming out and executing an eviction. So just wanted to note that. So in terms of advice, so I would say, first of all, please don't wait until they have that red and white in the sheriff. If they have a notice to appear in court, that is the time that they should start having conversations with us in terms of what financial resources we can support them with to stop that eviction. And whether that's RAP or whether that's even just our emergency stabilization funds, we want to bring those to bear. And I'm talking in general, right? Of course, now we have all of our COVID rent relief funds that are going out the door that are, with us for about a year or so, depending on what Congress continues to do. So as soon as they have any notice from the court related to eviction proceedings, they should be coming to us. If it's earlier than that, if it's just my income situation has changed, maybe my household situation has changed, and I am struggling, what we tend to recommend is to leverage some of our nonprofit partners who will work with households on financial literacy and family budgeting, workforce development. Like what are those sources that we could bring in to help the household relook at? Is there a way to adjust and stay here? That's also the time we recommend and checking and making sure, are there any other eligibility programs that they're could be receiving now? And especially if there is a change of income, right? Like I'm going to go back to OHAP and utility assistance. For many people, that program was not on their radar. And if not for COVID, they would have never known about OHAP. They would have never come in for utility assistance. But if you can get, $500, $800 to pay your electric or your gas bill, that might be the difference of having that money to pay your rent, right? And so they can reach out to 311 and we will make sure whether they call Office of Eligibility Services or if they get to OHAP or Housing Stabilization first, that we will make sure to connect them to all those other services that they may be eligible for in order to bring in, ultimately we're trying to bring in more financial resources into the household.
Well, and
housing.
I agree with all of that, especially the part that people don't know about the services provided until they desperately need them. And that has been the case all year long, essentially. Contacting us saying, hey, I'm in this situation, help me. And we've been helping. We as a county have been doing incredible work helping people. And so just want to make sure that I understand, good public policy, but sometimes we can't ignore the reality of how people operate and the fact that people might not contact us until they get that court order or until that notice is on the door. And so the best laid plan sometimes, off gang of glay, but we need to be able to adapt a little bit. And the only other question I have, just shifting to another point in the packet, it said that I'm looking at, I think it's noted as page 12 here, about rent or subsidies for individuals who are in family-owned units or in another unit in their family, and that there was a loophole that people were taking advantage of. Can you elaborate on that? How prevalent that might be, or any other information you can share?
Yeah, we don't have an exact rate of prevalence. I can try to look back. Because usually we catch them, but what we have. The program is a rent assistance program. It is designed for rent assistance, not mortgage assistance. And so we were finding that there were households where, for RAP, there's an application you complete, and then the landlord has to complete a certification form. And that you would have, if I'm living with my mom would complete the certification form, and effectively I'm ultimately paying the mom's mortgage. There really isn't a rental relationship there. We have found in some cases where it is, like where you may have a immediate family member who has moved out of the area, and instead of selling their home, they are using it as an investment rental property, and it just happens to be that there is a family member who is in that rental. And that's where I know Linda noted in the packet, we will review these on a case-by-case basis, and if we need to adjust, we can adjust. But in general, we were finding that there were a number of times where the full relationships between the household members was not being disclosed, and then therefore we were either not counting the total income of the household, right? Because if it is me and my mom, we're a household together and our income should both be counted. And we were therefore subsidizing and enabling people to be in the program who really shouldn't have been. And we could have been targeting our resources to a family more in need. And so we were having that issue that we weren't able to count that household income, or where that relationship wasn't even disclosed and we couldn't even just do those checks and balances. So we are trying to just close that opening. But again, I understanding that there are times that there are legitimate financial relationships and rental relationships between household members, and we will review those on a case-by-case basis.
Well, and thank you for detailing it a little bit more. And just as we spoke about people not knowing the services and programs available to them, some know the programs and services a little too well and know what the loopholes are. And as we're talking about finite resources here, and this whole conversation is about getting more help to more people, we need to make sure that those people legitimately need the help. And so I appreciate the attention to that level of detail and appreciate this package of updates and reforms so that we can fulfill the goal that we've all shared of providing more rental assistance to those who need now more than ever. So thank you for all of this. And Mr. Chair, I yield back.
Thank you. Good questions, good comments. Councilmember Rice.
Very, very quickly. And thank you, Councilmember Glass, because you actually spawned a question that I don't think I've ever asked before, and I'm ashamed that I don't know the answer. When we do intake, especially when it comes to folks with rental assistance, do we do a financial analysis of how much money they take in as well as their expenditures? When we talked about financial literacy, I just wanted to understand, and if so, then what do we do when we see that automatically they're underwater in terms of what their income is versus what their monthly expenditures are?
So for RAP specifically, part of the application requirements and the regulations is that we are looking at assets, at income, and at expenses. We do, if a family shows us income that does not pay their rent, we will have a conversation with them. Okay, you've been in this unit. How are you paying the rent? Because you're showing me you only make $1,000 a month and your rent is $1,200. And I know not 100% of your money is going to rent anyway, right? So our case workers will have those conversations with them. Most of the time we do find that there is cash or undisclosed income that is coming in from the households that's just not being reflected in pay stubs or bank statements. But we will have those conversations with them. And we do make sure that they know, again, whether it's OHEP or, if they're maybe not getting food stamps and we will direct them to those sources. If someone comes in for eviction prevention, part of our process really is to sit down with them and review that budget, right? How did you get to this point? So that if we're going to pay off that eviction, we want to make sure that you're going to be okay next month and the month after, right? And so we will sit down with them and review their budget. We will have those conversations with them about some of those spending patterns, right? Like, okay, you're spending $300 on cell phones. Could you get a different cell phone plan? Like, what can we look at to try to free up some cash? And we also try to focus the families on what's those core items, right? If you have to drill your budget down to the bare minimum for at least a little bit, what do we have to drill that down to? So we'll have those conversations with them, and that's where some of it leads to where we are going to make those requests for RAP, right? Because where are we saying that there aren't the resources there, right? We need RAP. If this family comes in for eviction prevention, we need this extra infusion of 300, 400, 437, whatever, where we set the cap to. We need that extra infusion in order to ensure that this household's budget does match and they can stay. I will acknowledge that we are not generally able to bring people's budgets down to that golden ticket of, only spending 30% of their income on rent. But we are trying to make sure that they have the money for, food, transportation, rent, that Maslow hierarchy of needs, walking through that. And those are the times also that if we are seeing that a budget, there is no way to balance this budget, that's also when we do bring in our housing locators and we work to have that conversation with that family of, can we help you identify alternative housing that does align more with what your financial resources are?
I appreciate everything that you just said, Alana, and let me just say that from my perspective, we need to add another element in there, and I know that you do it, but the partnership with WorkSource Montgomery as well, we need to look at the housing piece in terms of can you afford, but also say, okay, is this time for you, now that you want to continue on this pathway, for you to look at other job opportunities as well, and the opportunity for them to expand into something that may be more sustainable for the lifestyle that they currently have, right? Because we all know that while it sounds good to say, well, you need to downsize or you need to reduce your spending, the majority of people, regardless of where they are, us, folks who are rent burdened, all of us fall in that same category, are going to be resistant to that, right? And so from that perspective, the better thing to do is to increase income, which benefits all of us from that perspective. And so I really just would encourage, I know that Workforce Montgomery is under new leadership now with Anthony Featherstone, and they're really being creative and innovative in the things that they're doing, including their boot camps that get people from training right into jobs, and would encourage us to also provide that as options for folks and have those conversations and say, look, you can go two ways. You can downsize, or we can get you into another job that's going to pay you more money to help keep you and stabilize you in the pathway that you're currently in. And so I just think that having those two conversations, but really appreciate, especially the financial literacy piece. I've been very passionate about us trying to open up our Junior Achievement Finance Park and the financial literacy they do there with our young people to our adults as well. And I think that's a conversation, Mr. Chair, that we may want to span into another work session to really talk about some innovative ways in which some of these folks and some of the things that they do, it's actually eye-opening to go through that process. I went through it as a grown adult who's owned houses for quite some time now, and it was eye-opening, just that experience. And so I think that it's one in which we really need to see what other things we can also do to accentuate the great work that's already being done. So thank you guys, appreciate it.
Again, good questions and good comments. I'll just say a couple of comments as we wrap up this section. I think these recommendations are straightforward. Totally agree with them. I think that in addition to this, the other challenge is, and I think we've made great strides in cultural competency, but still there's a long way to go. We know so disproportionately the number of folks that are calling to access rental assistance or requesting language assistance, and it's more than just the language assistance. It's also the model that we have followed with the health promotores that I think has worked well, because as folks are coming to get their COVID test, or they're coming to a hub, or they're coming to receive their vaccination, they're entering through different means and different doors into the county system and working with a trusted organization or individual that becomes their guide and becomes their advocate, which is a really good thing. And as we've seen with the Por Nuestra Salud y Bienestar initiative and the initiative in the African American Health Program, it's sometimes community-based organizations that are in an even better position to help be that bridge, to help be that guide, because there's a level of trust that for a variety of legitimate reasons, folks are never going to have entirely with government or government operations or services. So I think that's a discussion we're going to have to follow up on. And the second issue that, again, not appropriate for this specific discussion, but something we'll need to elaborate on moving forward, I believe, is the type of assistance we provide to families who are in short-term crisis, folks that have been displaced because of fires, folks that have been displaced because of a natural disaster. Those things are becoming more prevalent, unfortunately, and that crosses over into support with the Red Cross and other organizations, but I think that's something we're going to have to follow up on as well, because there are increasingly larger numbers of families entering in situations like that. So more to come, but I appreciate both of you coming forward, and once again, I know Beth in my office often refers a lot of cases to you guys, and you've always been responsive and helpful, and we certainly appreciate that. And we look forward to forging an even stronger partnership with some of these community-based organizations I mentioned earlier. So thank you all.
Mr. Chair, can I
Councilmember Glass?
I appreciate the comments that you just shared, and also appreciate the thoughts of Councilmember Rice, and just want to, speaking about the collaboration and the need to outreach with all the different organizations, I'll share that as a member of the ICH, I a few months back met with the People's Committee, which are individuals who have been in the system. They were formerly homeless, and one of the connections I made with them, speaking about the skills and the personal development, was I connected them with Workforce Montgomery, to your point exactly, Councilmember Rice, figuring that the shelters are a prime location for that workforce development. So let's definitely continue that conversation. The connections have been made, and look forward to making that happen.
Awesome. So can I get a motion to?
Mr.
Go ahead,
Chair?
Linda. Yes.
Two things, one comment and then just a technicality about the motion before somebody makes it.
Right.
And so the comment goes back to the discussion about when DHHS steps in, but I did just want to say that especially in our current situation, we have tenants who are hearing from a property manager because they're late on rent. They get told, I'm going to evict you, you're going to be evicted, but they have not gotten a legal notice. And so I just want to emphasize that anytime somebody hears, I'm going to be evicted, and they have a question about whether it's really an eviction process, they can call DHCA, they can call landlord tenant, and they can get that assistance to understand where they really are in the process. Because often now people are told something that's not an official legal process, and then they start to, in essence, evict themselves, right? They think they have to move. They start to look for a place to move, and we don't catch those people. So we're really trying to get that message out as well. And DHCA in landlord tenant can be very, very helpful in helping anybody with a question around that. So I did just want to raise that as something that's going on right now. And then in terms of the motion, the way the regulation came over, it included the specific minimum and maximum amount of payment in this regulation. The law really requires that be done through a Method 3 regulation. And so if someone would be willing to make a motion that would be for the committee to recommend approval of an amended regulation that removes those components, then the executive branch is going to send us an amended regulation that takes those components out of this regulation and then also promulgates a Method 3 with the minimum and maximum. And then we wouldn't have to come back to committee.
Great.
I move what Ms. McMillan just said.
Jackie.
So moving the regulation before us with the future amendments that will come.
Yes.
I move that.
Okay.
Great. We got a second from Councilmember Rice. All those in favor, please raise your hand. All right. The motion passes unanimously. Anything else on this item, Ms. McMillan?
Nope.
Okay, great. Well, thank you, Ms. Harris. Thank you, Alana. I think you guys are staying for a couple more of these. But the next ones are really, truly technical in nature. But let's move on to item number 3.
Okay, this one is very simple. It makes the chief of Services to End and Prevent Homelessness in regulation have that correct title. Originally, when the position was created, it was the Chief of Special Needs Housing. We did update the law and the budget and everything else to be Services to End and Prevent Homelessness, but the regulation around the position description was never updated, and this simply updates that.
Great. Can I get a motion to approve Executive Regulation 2020 as recommended by council staff?
So moved.
Second.
Second. All those in favor, please raise your hand. That is unanimous.
Okay. The next one is regulation on eating and drinking establishments, nutrition labeling. And so this one also is technical in nature. It updates items in the nutrition labeling. So I don't have a lot of comments about the regulation per se. Mostly it's formatting and name changes. But I did just include in the staff memo to you some of the information about our nutrition labeling requirements, because I know this committee really hasn't ever had a discussion of that. Not that today's time for full discussion, but Mr. Bile is here. If you had any questions related to nutrition labeling, he could answer them. Other than that, I would just say that these are really very technical updates, and I would recommend approval as transmitted.
Great. Clark, did you have anything you wanted to add?
No, not at all.
Okay. Smart man. All right. Well, then, can I get a motion to update Executive Regulation 2120 as recommended by council staff?
I move.
Second.
All those in favor? All right, that is unanimous. And let's move on to the last one, Executive Regulation 2220.
And this is, again, like really technical changes, updating Department of Health and Mental Hygiene to Department of Health, just those updates that are needed. This is around the General Food Inspection Program. Clark could answer any questions you might have about how that effort's going, especially as some restaurants that may have been closed reopen. But in terms of the regulation itself, I would recommend approval as transmitted.
Great. Anything to add there as well, Clark?
No, sir.
Okay. Can I get a motion to accept the updated Executive Regulation 2220 as recommended by Council staff?
So moved.
Second.
All right, all those in favor? All right, that is unanimous as well. So that covers the 5 items that we had on this morning's agenda. Ms. McMillan, was there anything else?
There's not.
Great. All right, well, thanks everyone. Appreciate you. Go out and get your vaccine. All right.
Well done, Mr. Chair.
Take care.